Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and I am with Dr. Josiah Fitzsimmons from the Vero Health Center. And last time we were here, Dr. J, we were talking about knee replacement surgery. That is scary.
Absolutely not. Fun at all to talk about.
If you have to have that done, but you have some tips for folks that might be facing knee replacement surgery in their future.
Absolutely. So first thing with knee replacement surgery is you want to consider and know more of the facts of what might happen if you do need to have knee replacement surgery. Oftentimes the knee replacement is only going to last 10 to maybe 15 years. So if you think you're going to live longer than another 10 or 15 years, you're going to need another knee replacement surgery. Every time they do a knee replacement, they have to cut out your bones. And every time they have to do a replacement, they have to cut out more bones.
Oh, really?
And exactly. And if they have to do more than one, eventually they could even run out of bone to cut. And that's when it becomes really problematic.
Oh,
and that's when
gosh.
people, can have amputations, because of knee surgeries. Many complications can include things like blood clots, issues, with the physical therapy. And sometimes it takes 3-4 months of very intense physical therapy. You might never get your full range of motion back. And so there can just be many different complications, that could occur. Other health conditions, inflammations, infections, all sorts of complications that could occur, with knee surgery. So you just want to try and do it without knee surgery. If you can correct the cause of the issue without having knee surgery, that's the route you want to go.
All right, I like that answer better. I like not having knee surgery, and you have some alternative treatments to surgery that work.
Absolutely. We actually have multiple different approaches to knee. Instead of knee replacement surgery, what we can do is actually restore the tissue in the joint. So there is a nice space in your knee joint that you should have, and over time, arthritis, degeneration, wear and tear, that starts to beat up and deteriorate that joint. And that's when people get that bone-on-bone pain in the knee joint. And so that's what we need to start opening up that space. We actually have a piece of equipment that helps decompress or open up the space within the knee joint. And then we actually have advanced regenerative protocols that actually we can put human cellular tissue products right into the joint so your body can heal. Just like a little kid, a little kid falls down, they're crying for a few seconds, then they're perfectly fine. Same exact fall, an elderly person might end up in the hospital. We can use these natural and safe tissue products to actually regenerate the space in the joint. We can improve the blood flow to the joint. We can decrease the inflammation in the joint. We can actually get the joint in proper alignment. So there's actually 5 different parts to our knee protocol to prevent and avoid knee surgery.
Now, have you ever seen a case where somebody might have something else going on? Maybe it isn't the knee, but it's pointing toward the knee?
Yeah, absolutely. So oftentimes knee symptoms could be a result of something else. So someone might go get a knee replacement surgery, but maybe the cause is because you have back issues and therefore your knees are carrying your weight unevenly, or you have misalignments further up, or maybe you even have ankle issues. But those knees are really that centered part of your body that can take a lot of the stress and the pain. So you could have an issue, the cause of the problem could be somewhere else in your body, but you feel the pain and symptoms in your knee. And so if you just treat the symptoms, but you don't actually correct the cause of the issue, the problem's just going to come right back, because maybe your back was the issue, maybe your hips were out of alignment, maybe you have other issues throughout the rest of your body. So when you come into our office, we do a full evaluation. We're going to figure out what's actually causing the problem. Most places, they just treat your symptoms, and you might feel good for a little while, but if you never correct what's causing the issue, it's kind of like pulling the top off a weed. You're just going to grow right back.
It's still there, it's going to come back. But we want to give you a hand. We want to give you some assistance in trying to find out what is the root problem. Speaking of weeds, what is the root problem with your knee surgery? And you have a special going on right now, which is awesome.
Absolutely. So biggest thing is we want to come in, see exactly what's going on. We'll do a full knee evaluation, figure out exactly what's going on. We'll meet with one of our 10 doctors, come with an individualized game plan. Like I said, figure out the cause. You come in, you have your knee as your main complaint, but maybe you have other conditions that are contributing more to your knee pain than you realize. We'll figure out exactly what's going on. Amazing special, almost $200 off to come in and get the initial evaluations.
Yeah, for only $37, but you need to give them a call, okay? 515-335-VERO. That is the number, 335-VERO. Call that number, make an appointment. Your location, your new building is absolutely gorgeous. If you haven't been out there yet, you need to go check that out right off of I-35 on South 50th Street. It is 630 South 50th Street, right over there in West Des Moines. You can really have just life-changing differences after visiting your place.
Yeah, I mean, there's been people that have been coming in with canes and walkers, and they no longer have those anybody. We've even had people get out of wheelchairs. There's been people like like I said, that have had knee surgeries scheduled, and they've been able to cancel and avoid those surgeries. And so that's what we want for people, is you want to get back to the quality of life, to be able to enjoy the weather. We got nice summer activities. We got the Iowa State Fair coming up.
Right.
We got time with grandkids. We have all these fun activities that people want to be able to do, but you just can't do them with knee issues. That's where you see so many people, speaking of the fair, driving around with the mopeds and the scooters because they just aren't have the mobility anymore. And so we got to get to the cause of the issue, stop treating the problems, correct it at source, get long-lasting results so you can have your maximum potential and really enjoy your life to the fullest.
All right, give them a call, folks. 335-VERO, 515-335-VERO. Take advantage of the $37 knee pain special offer that Dr. J is offering right now and start feeling better sooner rather than later. Dr. Josiah Fitzsimmons, thank you, sir. Great to see you as always.
Thanks for having me.
We will be right back. This is Iowa Live.